Next up, Nuria, I do hope that I pronounce your name properly. Nuria Toro Polanco. Yeah? All right, not bad for a Scots person, who's going to give us a bit of a perspective from the WHO and also just around the work that they're doing on integrated care and the collaborating work with the Scirocco project. So thank you very much. Now, Nuria does have a video, so just bear with us. I'm sure it'll all go very smoothly, but we do know how the technology works, so we'll make sure that it works.
Oops. Okay, so thank you very much, Donna. So good morning, everyone. Thank you very much to organizers, and thank you very much especially to Andrea for having invited me to participate in this exciting final conference of the Scirocco project. It's really a big pleasure for me to be here with you today, and it's also a big pleasure for me to have the opportunity to present the WHO framework on integrated people-centered health services. So let me start by very briefly talking about the global context that health systems around the world have to cope with. It is a context that is very much familiar to all of us. It's a context characterized by many, many challenges, such as the challenge of aging, NCDs, urbanization, globalization, climate change, rising costs in a context of ongoing economic and financial crisis, migration, citizen voice. And I'm going to stop here a little bit. The citizen. We find a citizen that is more and more demanding, and a citizen that is showing increasing expectations in terms of health systems. But at the same time, and that can also be considered an opportunity, it is a citizen that requires a more active role in all aspects related to his or her health. Which are the consequences of these challenges? These challenges are being translated into a series of emerging demands. Emerging demands that our current health systems cannot cope with. And I'm talking about emerging demands such as unhealthy and lifestyle choices, in many cases as a consequence of globalization and urbanization. I'm also talking about double burden of disease, communicable and non-communicable disease and multimorbidity, and we know in Europe a lot about this. We are talking about greater citizen expectations, and as I just mentioned before, we are talking about an increased need to self-manage care as a consequence of multimorbidity, chronic conditions, and also the need for cost efficiency and accountability. And as I mentioned before, our current systems are not prepared for this. Why? Because we have a lot of system constraints. We have lack of community engagement and empowerment. We can also say that the financing is insufficient and usually misaligned. When talking about health workforce, it is usually suboptimal in terms of volume, but also in terms of distribution and in terms of skills. Service fragmentation and inappropriate service delivery model. And again, we know a lot about this fragmentation, hospital-centric models of care, et cetera, and intersectoral action is quite limited. Which are the consequences of all this? We have unequal access, poor quality safety, deficient participation, and overall low satisfaction on the side of patients. In this context, the World Health Organization started to develop a framework on integrated people-centered health services in the year 2013. And this is a framework that is proposing a very much ambitious vision, a vision of a future in which all people have equal access to quality health services that are co-produced in a way that meets their life course needs, are coordinated across the continuum of care, and are comprehensive, safe, timely, efficient, and acceptable. And this is not just about the patients. And as you can see, the second part of the vision is about carers. It's about providers, formal and informal providers. All carers are motivated, skilled, and operate in a supportive environment. So, we talk about integrated people-centered health services. What is that? We know it's a very much long title. There are a set of principles that are usually attached to these health services. They are health services that are empowering, they are goal-oriented, they are respectful, collaborative among key stakeholders. They promote co-production between users and producers. They are comprehensive, equitable, sustainable. They put a focus on promotion and prevention. They are endowed with rights but also responsibilities, continuous, coordinated across the continuum of care, etc., etc., etc. What is people-centered care for WHO? Let me play a video in which we can see some of the elements that have been discussed so far.
Around the world, people are living longer, but often with multiple diseases and conditions that require care over many years. And unfortunately, too many people are not informed or consulted in the care they receive. In some countries, only 1 in 3 people have the risks of their treatment explained to them. 1 in 5 people have at least one unnecessary test. And up to 40% of health spending is wasted due to inefficiency. Healthcare should not be like this. Remember, people live with their condition 24/7, not only when they seek care. That's why people-centered care is so important. People-centered care means ensuring that health services are tailored to people's needs and are provided in partnership with them rather than simply given to them. It means care where people, families, and communities are respected, informed, engaged, supported, and treated with dignity and compassion. People-centered care can have lasting benefits. It improves the trust, experience, and outcomes people have from care, the confidence and job satisfaction of health professionals, and the quality and efficiency of health systems. People-centered care can increase access to health services and reduce unnecessary use of services. Ultimately, it means people get the right care at the right time and in the right place. But too often, this type of care is not standard practice. Implementing people-centered care requires fundamental changes in our approach to healthcare. It means rethinking how health services are organized, managed, and delivered. It means shifting away from asking, "What is the matter with you?" to "What matters to you?" Around the World Health Organization is working with countries to design health systems that put people and their needs at the center of care. Because that's the healthcare that everyone deserves.
Okay, so before I was talking about the WHO framework on integrated people-centered health services that WHO started to develop in 2015. Okay, so the framework. So WHO started to develop this framework in 2015. We can say that it is basically proposing a new way of thinking about how health services should be organized, managed, and delivered. And as you can see here, the framework is proposing 5 interdependent strategies to move forward. The first strategy is about engaging and empowering people and communities so that they can take an active role in their health and in their health services. The second one is about strengthening governance and accountability to build legitimacy, trust, and also transparency, and to achieve results for populations. The third one, reorienting the model of care to ensure that care is provided in the most appropriate setting to maximize health results and also to maximize efficiency of the system as a whole. And the fifth one, creating an enabling environment to facilitate the implementation of sustainable change. And here we are talking about those macro variables that should be supporting the implementation of these 4 strategies. I'm talking about political leadership and commitment, and also talking about adequate regulatory frameworks, but of course information systems, workforce orientation, etc., etc., etc. So, in 2016, this framework, along with its supporting resolution, was approved by the World Health Assembly, and this means that 194 countries said yes to integrated people-centered health services in Geneva. During that week, we were able to hear very much encouraging statements from countries that really believe in a people-centered approach. And here we have some quotes from countries such as Austria, saying that empowerment of individuals and communities in their dealings with health services is imperative. Or quotes from Canada, for example, saying that healthcare systems should empower citizens, facilitate continuity and coordination of care, and address inequitable access. Senegal was saying that the new campaign for people-centered health services mark a return to the principles of primary healthcare centered on the family and the community. And these member states also supported the framework itself, saying that this framework attempts to take a holistic approach to health services, and that was something mentioned by Liberia. The framework is essential for meeting new challenges from Guinea, or the framework sets out suitable strategies for establishing a health service system able to cope in the long term with issues such as aging and rising healthcare costs according to the context in each country. And this was mentioned by Japan. So, in this resolution, member states, countries were requesting and country offices. So, as I mentioned before, we are developing these critical pathways towards integrated people-centered health services in order to be able to implement this framework successfully. This document has a twofold objective. On the one hand, it's going to provide policymakers with a self-assessment exercise, and it's here when our conversation with Sirocco partners started, when trying to identify different maturity models on which to draw on for our self-assessment, because one of our biggest challenges is try not to reinvent the wheel all the time. So we want to build on what is already available. And it also proposes a set of 10 policy levers to drive forward the system-wide changes that are going to be necessary to implement those 4 strategies, or in other words, those policy levers that are going to be needed for creating that enabling environment. So, I thank you very much for your attention and look forward to our strengthened collaboration with Sirocco partners. Thank you very much.
Thank you very much, Nuria. And even though we tried that video, we failed.
Maybe next time.
There's always got to be one technical hitch. Anyway, thank you very much for that context. And again, I think what's really interesting here when we've listened to Philippe and Nuria giving us the kind of context behind the current policy drivers for integrated care is that the focus is now really shifting to supporting implementation, which very, very much fits with where we are with the Sirocco project. So it dovetails very, very nicely. Has anybody got any questions that they would like to direct? Stuart, if you could just say your name and where you're from for our audience. Thank you.
I'm Stuart Anderson. I'm from University of Edinburgh. I wanted to ask you about the role of demand reduction in your strategy, because in the UK, certainly what we've seen is increasing spend on health services and declining spend on education. And also, I mean, there are other issues like the inability to control the food lobby, I think, but never mind about that. But in education, then having good education about health and having good exercise regimes in school actually will make a massive difference in terms of demand. But I didn't really see where that played into what you were saying.
Yeah, no, thank you very much for this question. As you might remember from the beginning, I was talking about limited intersectorial action. And here we are recognizing that there are many things that can be done in other sectors, such as the education sector. And it's currently one of the interventions we are promoting. I mean, it was a short presentation and I didn't have time to explain all the strategies in detail, but that's indeed one of them. Try to be able to collaborate closer with the education sector so that we are able to really convey these messages to students and to younger people, yeah.
I suppose one of the things I'm thinking about is budgets, yeah, because what we're seeing, certainly in UK, is this increase in one in health and decrease in the other. It's whether the budget can be seen to be spent in the other services in some sense, that health spend is actually being spent in education, because I think that's a critical issue.
Yeah, no, definitely. I think that each country has to look for the best solution, but I mean, I totally agree that that can be one of the options that can be chosen by UK, for example.
Great, thank you, Nuria. David, if you can just say who you are and where you're from.
Hello, David Somek from the European Health Futures Forum. A great presentation. Obviously, it's kind of motherhood and apple pie, isn't it? There are a lot of things there which we all agree with. The problem is the barriers. And I was struck, one of the things you didn't mention in the health system presentation is increasing health inequality and the fact that the current financial system is driving it. And there's another barrier which I thought was somehow absent, which was the innate conservatism of health professionals, their unwillingness to change.
Yeah, you are absolutely right. And I think I mentioned unequal access when talking about the current situation. So again, it was a short presentation. We know that there are so many challenges, but for sure, we know that inequality is one of the biggest one. And WHO is taking this issue very much seriously, and it's not just our Department of Service Delivery and Safety, the one that is dealing with this, but also we are collaborating very closely with other departments that are working towards leaving no one behind.
Great, thank you very much, Nuria. Any last questions for Nuria before we move on? No, that's great. Well, thank you very much for your time and for coming here today. Okay, so next up, so we've heard from the European Commission, we've heard from WHO.